Dr. Jennifer Cole is a lecturer in global and planetary health at Royal Holloway, University of London. She's a biological anthropologist with a background in policy research. Her own research focuses on human behavior in response to social and environmental drivers of health. And among other roles, Jennifer is also a member of the SOPHEA Scientific Advisory Board. So Jennifer, it's always great to work with you. Over to you, and please share your slides.
Thank you, and thanks for having me back again. It's always a pleasure to be on the other side of this as well. So what I'm going to do in my presentation is look at particularly some of the health impacts along the planetary boundaries. My own research in this is very much really focused on heat and heat stress, but I'll bring in where that impacts on some of the other planetary boundaries as well. So the first thing I'll do is just give a brief overview of health in Africa. As I'm sure most people are aware, life expectancy in Africa is generally lower than in the rest of the world due to a whole series of inequalities that we can go into and cover. But where most of that life expectancy is particularly badly hit is in youth. You can see here, this is the number of newborns and children who die before reaching the age of 15 in Africa is much larger than in the rest of the world. And that is still really where a lot of that health disparity happens. And that ties in very nicely with Elias's presentation on antimicrobial resistance, because obviously infectious disease and inability to treat infectious disease is a huge part of that. But what we do know is that health in Africa is already poorer than in the rest of the world. Africa is already struggling with providing health and healthcare services. And then if you go to climate change, what you see almost is that map reversed, that Africa, and particularly countries in sub-Saharan Africa, are some of the ones that are most vulnerable to climate change. So Africa already has this double burden of being kind of struggling the most, perhaps most of the regions of the world, to provide healthcare, while being the most vulnerable to the impacts of climate change and environmental change. And yet, and if we look at that particularly in terms of the planetary boundaries, this is, I apologise, these images here are quite small, but this is from a website created by Leeds University in the UK called A Good Life for All within Planetary Boundaries. And what they've done is for every country in the world, and increasingly for cities as well, they map whether or not those countries and cities have exceeded planetary boundaries, but also whether they have achieved some of the social indicators of the Sustainable Development Goals. Because very much what they want to do is show that if we exceed planetary boundaries, we also have to do that while achieving the social goals of the Sustainable Development Goals. And what this creates, which sounds like you heard about in the last one, is the same donut of donut economics, which is this safe operating space for humanity. And what we see is that African countries, by and large, haven't exceeded the planetary boundaries. They are generally at the moment operating within planetary boundaries. But sometimes where they fall short on the Sustainable Development Goals is some of the more social indicators of things like equality and of education. So again, we're seeing that challenge of being able to live sustainably within planetary boundaries while actually having the equality that global North countries have. The countries I've chosen here are dotted around Africa, so I'm not focusing on one area. I'm looking at the area of Africa as a whole. So we've looked at Kenya, where a lot of my work's taken place, Liberia in the northwest, Chad, which is more central, Morocco, which is close to the Middle East, and Tanzania. But as you can see, it's fairly similar as you look across Africa. So when we talk about planetary boundaries and a good life for all within planetary boundaries, Africa largely is not exceeding its planetary boundaries at the moment. But one thing that we do know from looking at other countries is that what tends to happen with the countries that have low planetary, or they're not exceeding their planetary boundaries at the moment, as they develop, they come closer to exceeding them. And what is very important with the planetary boundaries is to make sure that as countries develop, they develop cleaner. We know that shifts to cleaner energy, to perhaps better managed urban expansion, can prevent those planetary boundaries being exceeded while still meeting the social indicators in the centre. And this is particularly important from Africa, because we look at just one of the planetary boundaries, carbon dioxide emissions. and which countries are responsible for the carbon dioxide emissions and for that climate change, which is making Africa vulnerable, what we see is that Africa has very low carbon emissions. Again, Africa is not the cause of the problem, but it's suffering from the problems that are caused elsewhere in the world. You can see in particular the Americas and the Western Pacific region are the areas that have the most carbon emissions. Europe is doing reasonably well for the world overall, but Africa is not responsible. And what this also shows is obviously there are large cities, there are mega cities in Africa, but you can have mega cities as a country without, as a continent and a region as a whole, exceeding your planetary boundaries. It is possible. And so what we're really looking at is bringing these things together. We need to make sure that health systems, health services, healthcare professionals are able to provide the healthcare that a population needs, but they need to do that within planetary boundaries. And at the moment, Africa is really bearing the brunt of the rest of the world's exceeding of planetary boundaries. And what we can see as one of the consequences of this is that as it is in most places of the world, annual temperatures in Africa are increasing. You see this is probably a common graph to most people. Temperature always fluctuates from year to year. It's sometimes hard to see when the beginning of a curve starts. You may have perhaps thought it was starting to go exponential here, but then we get a colder and wetter period in the middle of last century, to the middle of the end of last century. But then it has definitely been increasing since around about 1990. And what this means for Africa is it's having those health impacts that the rest of the world is seeing as well. And just to give some of those figures, you can see, 110 million people directly affected by heat-related hazards, things like heat waves, floods, tropics, cyclones, and droughts. And obviously that has impacts on other planetary boundaries, such as land use and water. It's facing 8.5 billion annual economic losses, and around about 5,000 fatalities caused directly by severe weather events. And those are usually most of those are either drought-related, where food can't grow and therefore people just don't have enough food to eat, who could be flooding related, where people are killed directly in floods, or again, the floods have a severe impact on the production of food. 55% of the African economy is dependent on agriculture, but this has actually been declining. So again, what we see across the world is that the climate gets more erratic, less reliable. People try to move away from farming economies because they're very dependent on the weather. And so this has economic impacts as well. And one of the impacts that it's predicted that will have in Africa is that food imports will triple. And so that Africa will try to import more of its food elsewhere as growing its own food in country becomes more difficult. And that obviously has implications both for the economy, but also what we know is that people who don't have their own land, and whether that's at the family level to be able to grow your own vegetables, whether that's at a community level to have community gardens and farms, or at a national level, those countries are more susceptible then and more vulnerable to food price increases across the world. So the less of your own food you're able to provide, the more you are likely to lose out if there are wide-scale either droughts or floods or food production issues across the world. And obviously the links between health and nutrition don't really need to be stated. This is causing a huge amount of loss annually to the economies, which prevents African countries from being able to develop as quickly as they would be able to, and perhaps also sometimes to invest in the things that we know would save money and improve health down the line, or to go for some of the more innovative, but at the moment more expensive options. And there are also concerns that some of these challenges could then fuel conflict and displacement, particularly if people move around because their farming land has become less easy or less reliable to farm than it's been in the past. And we can see that all of these have knock-on effects. There's lots of research has been done on the effects of displaced people, and we know that displaced people tend to have poorer health overall than the communities they move into. They also tend to put a strain on the healthcare of those communities. Particular impacts that it has, we know that heat stress and climate change in particular impacts, for instance, cardiovascular vulnerability. People who particularly have cardiovascular conditions are more susceptible to ill health in heat waves. We see hospital admissions go up, which again has a big impact on the economy and on the healthcare workforce. There's neo and perinatal vulnerabilities. Babies are much less able to regulate their temperature than older people. We also see increased infectious disease, which again, babies are more susceptible to. So we see potential increases again in childhood and child mortality, which is already putting a burden on Africa's health. We see problems such as heart rate dysregulation, blood pressure dysregulation. We also see increasing dermatological issues, both just from prickly skin, heat stress itself, but also from fungal infections. We see increased chronic kidney disease, and in particular, some of the work I'm doing at the moment in Cambodia, we're seeing huge increases in chronic kidney disease due to higher temperatures, and that's particularly where it's hot and humid. And we generally find that actually in terms of climate change and environmental change, for human health, hot and humid is actually much worse than heat on its own. And we also see increased fungal parasites, which also impact health. Again, there are lots of statistics about the way that health is being impacted, but in particular, as I mentioned before, infectious disease is a big increasing area where you have environmental change. And that goes back from conditions becoming more favourable for virus or bacteria spread. Usually if it's hotter, if it's warmer, the vectors can range further. There may be more vector breeding grounds. We're particularly seeing across the world where temperatures are increasing, things are becoming more humid, increases in dengue virus, but also in malaria, which is already a problem in Africa. And this is exacerbated where you have rapid urban expansion that brings with it poor sanitation, poorly planned urban expansion, and this can go together to cause poor nutritional status. The work that we've been doing in Kenya with the University of Eldoret, one of the results that's come out of that research, which was not expected, is that what we were trying to show is that a family has its own land, if it's able to keep perhaps its own dairy cow and chickens, that's likely to have a better nutritional output for the family and the children. We found that is true, but it is only true if the family also have improved sanitation under the World Health and UNICEF definitions of improved sanitation. If you keep your land, you keep your animals, but you don't have improved sanitation with it, the increasing risk of infectious disease from that less hygienic environment actually offsets the benefits of the extra nutrition you're getting from being able to produce your own food. You can expand cities in the way that allows room for urban gardening, for small-scale farming to be maintained, but it has to be planned that way. And there has to be room for animals and for community gardens left within that city. What we see with a lot of global north cities that are sometimes populations are reducing as population shrinks is that where there is empty space in those cities, that's where small urban farms and urban gardens open up again. But actually, there's no reason to lose them in the first place. We increasingly know that more green space is better for all kinds of health, from mental health to community cohesion to exercise. And if we can keep that space for urban gardens and urban farming within the cities, it improves health all round. And what you also need to that is to make sure that there is room for healthcare infrastructure in that, so that as cities grow, the healthcare infrastructure grows with it and provides the healthcare that people need. We know that early intervention in health, investment in preventative health rather than treatment after the effect, saves money along the line. So the more that we can actually plan this in with the knowledge of how climate change is going to impact individuals and communities in the future, the more we can actually make sure this is built in during periods of urban expansion. Sort of a real challenge with any area that is expanding rapidly is poor urban planning. What we also see is areas of huge wealth disparity, where you have very kind of modern, very affluent, very say in healthy cities like this, but very close to informal settlements. And that can have implications for both. One of the things we're saying, again, going back to antimicrobial resistance, which is my main research area, is that we're seeing that antimicrobial resistance and antimicrobial resistant bacteria spread more quickly through lower income regions and through lower income markets and cheaper meat than they do between kind of higher, more affluent food chains. And so this can actually be if you're not bringing up the whole city at the same time, if you're not dealing with these issues of inequality, you're actually opening up health impacts for the entire country. And if you have that on top of climate change, you're trying to deal with everything at once. But if you don't build climate change into those plans, you won't actually think about how that expansion can be planned. We see definitely with heat stress, we see issues with famine, and particularly with drought. And what that might mean again is that as countries go forward, as they look at their food supply into the future, that may involve having to plan, perhaps changing some of the crops that they grow or the strains of the crops that they grow. But it's extremely important to plan that well. What we've seen in some of our research in India, where a lot of the crops have moved over from the traditional Indian maize crops to American maize, which is more drought resistant. It's also brought with it invasive parasites, which have had impacts not only then on the maize crop, but also on other local crops such as chickpeas. So if you are looking to adapt the farming that you're doing to account for drought, you need to actually do that very carefully to make sure it doesn't cause more problems. We see as well that drought will push farmers from crop farming into livestock farming. If that livestock farming, again, is not well managed, if the farmers aren't really given support to be able to manage their livestock properly, that can see a huge increase in the use of antibiotics that are used. And also we know that increase in livestock has, that the land use moving from crops to livestock is also a way that you can exceed planetary boundaries very quickly. So you need to be keeping the whole system in place as you go forward with this. Flooding as well, we see lots of issues with floods. That again has issues with fresh water on the planetary boundaries. This is increasing, and as I said again, what we know from climate change is it's not only the heat, it's heat and humidity together that causes the problems. Add this in with some of the problems I mentioned about already with sanitation and making sure the expansion of sanitation is planned properly. This all adds to the challenges. I said we're working at the moment in Kenya in particular. We're looking there really at the aquaculture and some of the challenges with expanding aquaculture and moving fish around tied into the climate change challenges. One thing we do know is that fish can actually be a more sustainable form of protein production than, for instance, chickens, where the climate is increasing. If the climate is getting hotter and wetter, that's actually easier to expand aquaculture than it is to expand some other farming. But how do we do that in a way that makes sure we don't store up all of these health problems? So we're looking really at how do we develop sustainable food systems for Africa? How can we increase research capability and particularly in One Health, so making sure we're looking at that human-animal health system together. And with the University of Eldoret in particular, we're looking to create a centre of excellence in East Africa and also to help Eldoret win more funding for investment in research infrastructure. We're very keen to make sure that we tie that with SOPHEA as much as we can. It's been great to link up some of the work that we're doing with Eldoret, with QHAS and Tanzania. We're hoping to do that, as you know, further with some of the universities we work with across the UK and Germany. And I think the more this network maintains itself beyond the life of this project and creates more of those networks to work together, the more we will be able to help move this forward in a way that most importantly stays within the planetary boundaries while ensuring health for all within that safe operating space. Thank you.